Good morning, and thank you all for joining us. Before I begin, I want to recognize and thank Michael Firestone, Haley Hughes, and Veronica Darwin, and all of the EPA staff that worked so hard to see this project through to completion. Today's announcement is the result of a lot of hard work across multiple agencies, so I also want to thank everyone else who contributed to this action plan. It is a privilege to have Secretary Ben Carson here with us today. I can't think of anyone better to explain the importance of today's announcement than Dr. Carson, who is one of the world's foremost pediatric neurosurgeons. We're also delighted to have HHS Deputy Secretary Eric Hargan here, and you'll hear from him and Secretary Carson in a few minutes. We're gathered here today to announce the new federal lead action plan and lay out our roadmap to reduce lead exposure nationwide. The first and most fundamental responsibility of government is to protect the people, especially the most vulnerable among us. Lead exposure is a calamity that disproportionately harms children and low-income communities. All Americans, regardless of their age, race, income, or home address, deserve an opportunity to live in safe and healthy environments. That is why President Trump and this administration are committed to tackling this problem head on. Here at EPA, we are combating lead exposure on all fronts: in homes, schools, consumer products, and drinking water. We're updating the lead and copper rule for the first time in over 2 decades. We are strengthening the dust lead hazard standards, and we are using our grants and financing programs to help communities test for lead, replace lead pipes, and upgrade water infrastructure. We recently published a booklet titled Protecting Children from Lead Exposures that will increase public awareness of these programs and grants. And today, EPA and our federal partners are releasing the new Federal Lead Action Plan. This plan is the product of an impressive collaboration among the 17 agencies that make up the President's Task Force on Environmental Health Risks and Safety Risks to Children. It is the blueprint for federal collaboration, and it will enhance our efforts to reduce lead contamination, especially in areas where it presents a serious and urgent threat to children. The action plan has 4 primary goals, and I'll say a quick word about each. Goal 1, reduce children's exposure to lead sources. The plan details specific actions to target lead-based paint, lead in drinking water, lead-contaminated soil, and lead in consumer products, among other sources. By focusing on the sources of the problem, we can address the contamination before it impacts children. Number 2, identify lead-exposed children and improve their health outcomes. The plan lays out ways to expand lead testing and then ensure that children who are identified as lead exposed get the help and care they need and deserve. Early identification is critical. It allows healthcare providers to intervene sooner and improve the life outcomes of affected children. 3, communicate more effectively with stakeholders. The document identifies ways to streamline and improve federal messaging on dangers of lead exposure, particularly to minority communities and those with limited English proficiency. I'll say more on EPA's efforts to improve risk communication in a minute. Number 4, support and conduct critical research to inform efforts to reduce lead exposure and related health risks. Our goal is to generate better data and maps so that we can pinpoint high exposure communities and target resources to them quickly and effectively. Building off of the action plan, here's what EPA will do next. We will develop an EPA-specific implementation plan by March of 2019. This will include performance metrics for monitoring our progress and keeping ourselves accountable to the action plan. We will provide regular updates on our progress, and we will continue our aggressive stakeholder engagement and outreach. Improving how we communicate risk is one of my top priorities for the agency. We must be able to speak with one voice and clearly explain to the American people the environmental and health risks that they face in their daily lives. Our need to improve risk communication, in my mind, goes back to our response to 9/11, when some of the information that the agency released around the ground zero residents and the apartments and condos in New York City ended up not being the most accurate or correct data. 9/11 isn't the only example, though. There's the Kanawha River in West Virginia a few years ago, the Gold King Mine in Colorado, and most recently, Flint, Michigan, which has become the poster child for our need to improve risk communication to impacted and affected communities. How we communicate risk disproportionately impacts disadvantaged and underserved communities. They are the ones who often live, work, or go to school near areas with environmental hazards. They are most impacted by how well or how poorly we communicate risks to them on their health. EPA owes it to the American public to be able to explain in very simple and easy to understand terms what are the risks that they face in their daily lives. I've made this a priority in my visits to all 10 of our regional offices, and I'm proud to say that we're already seeing progress. Take the city of St. Joseph, Missouri. In older neighborhoods throughout the city, there are still homes covered in lead paint. From 2010 to 2015, 15% of children tested in St. Joseph had elevated blood lead levels. That's more than 3 times the national average of 4%. In response, our EPA Region 7 office made St. Joseph the focal point of a new lead task force. They are working closely with the city and local community to increase awareness of the dangers of lead-based paint and help families and schools address it. As a result, the number of children being tested for lead has decreased in recent years, and many more families are becoming aware of the dangers and taking steps to safeguard their children. Last week, the mayor publicly recognized and thanked EPA for its efforts. This is the type of leadership and action we are trying to encourage throughout the country. Our efforts also extend outside the federal agencies and across party lines. I've had a number of meetings and conversations with Senator Tammy Duckworth of Illinois, who has introduced several pieces of legislation designed to prevent lead exposure. She's very committed to this issue, and we're working with Senator Duckworth and other members of Congress to address this important health issue. As we move forward, it's important to remember that the U.S. has made tremendous progress reducing lead exposure over the past several decades. By strengthening laws and regulations, the median concentration of lead in the blood of children ages 1 to 5 has dropped roughly 95% from 1976 to 2014, but more work needs to be done. The new Federal Lead Action Plan is an important roadmap that will guide federal agencies and our state and local partners as we work together to protect children and improve their futures. President Trump and this administration are committed to ensuring that all children, regardless of their zip code, can live, learn, and thrive in safe and healthy environments. Thank you all for your time, and I now have the privilege of introducing the Secretary of Housing and Urban Development, Ben Carson. Prior to becoming HUD Secretary, Dr. Carson devoted his life's work to protecting the development of children's brains. As the former director of pediatric neurosurgery at Johns Hopkins Hospital, he is intimately aware of the devastating effects of lead poisoning on a child's mental and physical development. As a neurosurgeon, he transformed the lives of thousands of children for the better, and now he's doing the same here in Washington. So please join me in welcoming Secretary Carson.
Well, thank you very much, Acting Administrator Wheeler, and soon it won't be acting anymore. It's been wonderful working with you and your team, and they've been extremely cooperative and helpful, and also delighted to be here with Deputy Secretary Hargan. You know, this whole initiative started when you were the acting HHS head, and it's been wonderful working with that team as well. Thank you all for joining us today. And I need to recognize some of our talented HUD staff who are here today. You know, from the Office of Lead Hazard Control and Healthy Homes, our director, Matthew Ammon, who has worked extremely hard to bring this day about, along with Michelle Miller, Peter Ashley, Warren Friedman, and Kit Rodkey, along with several others. It's been a labor of intensity and love. And they all do a tremendous amount of work to carry out our department's lead remediation efforts. And they work closely with the other agencies that are here today on this federal action plan. I also want to thank Secretary Azar for the efforts that he has fostered along with Deputy Secretary Hargan in this fight against environmental hazards to children's health. And I look forward to building on this important work together in the future. Now, today we are here to unveil a federal action plan to reduce childhood lead exposure, and HUD will also be announcing later on today nearly $140 million in grant funding to 48 states and local government agencies to help protect American children and families from lead-based paint. And you will actually be able to see the award amounts and the various districts that receive them on our website later on today. Lead exposure has two distinct qualities. First, its intensity, which is so severe that it can have crippling long-term effects. And second, its invisibility, as it can go unnoticed by those who are not directly affected. That's why lead testing in children is critically important. The earlier the detection is done, the more impactful the intervention. Lead poisoning and its impact on children is uniquely personal to me. Prior to becoming the HUD secretary, my life's work was as a pediatric neurosurgeon, and it was to heal, to treat, and to protect the human brain. The brain, which serves a very important purpose, is the home of the mind. And no mind is more precious or more fragile than the mind of a child. A child's mind is blessed with nearly infinite possibilities to develop and to accomplish. You think about the brain and how complex it is, hundreds of billions of cells and interconnections, and the ability to process more than 2 million bits of information per second. And we certainly, with a tool like that, don't want to allow anything to happen that will decrease its ability. That's why every single one of our children is a resource for us, and we must protect them. Early in my medical career, I discovered that there is no satisfaction greater than that of preserving and protecting the mind of a child. For this reason, the treatment of children became a calling for me. From doctor to neurosurgeon to chief of pediatric neurosurgery at Hopkins, I was made acutely aware of the pernicious effects of lead poisoning on a child's mental and physical development. As a surgeon, some of my saddest moments came after treating a child, overcoming the odds by mitigating a seemingly intractable disease, and then watching that child walk out of the hospital door, in many cases back to a hazardous home environment. And as a doctor, my power to help that child ended the moment they walked out of that door. Which leads me to our work at HUD. I'm committed to making sure our department's resources reach the doors of high-risk American families at the prevention stage, long before their children are exposed to dangerous chemicals for which they might later need a cure. HUD works with public housing authorities and private landlords across the country to provide affordable housing to approximately 5 million households. To help ensure the children and families we serve are safe, HUD's Office of Lead Hazard Control and Healthy Homes provides technical guidance to our local grantees and other stakeholders to confront hazards related to rehabilitating damaged homes, such as mold, lead-based paint, and asbestos. Earlier this year, HUD announced that it would make lead hazard reduction grants available to help eliminate dangerous lead-based paint hazards from lower-income homes. Today, we are announcing the winners of those grants, who are working to protect high-risk American children and families. HUD is also very proud to have participated in the President's Task Force on Environmental Health Risk and Safety Risk to Children. Today, the task force is unveiling its blueprint, the Federal Action Plan to reduce childhood lead exposures and associated health impacts. The action plan has 4 goals, and I will repeat them again because psychologists tell us you need to hear it 3 times before you remember it, okay? They are: 1, reducing children's exposure to lead sources; 2, identifying lead-exposed children and improving their health outcomes; 3, communicating more effectively with stakeholders; and 4, supporting and conducting critical research to inform efforts to reduce lead exposure and related health risks. And all of those 4 goals are being done in conjunction with the other agencies. The plan will accomplish these goals through collaborative efforts and with a range of stakeholders, including states, tribes, and local communities, along with parents, businesses, and property owners. We congratulate today's winners of the lead hazard reduction grants and look forward to working with fellow task force members to enact this powerful new blueprint and doing our part to take the lead in tackling lead. And with that, I'd like to welcome Deputy Secretary Hargan to the podium. Thank you.
So thank you all for being here. Thank you, Dr. Carson. Thank you, Acting Administrator Wheeler, for hosting us here today. And I'd like to echo Administrator Wheeler and Secretary Carson's remarks. I'm not going to say I'm going to walk through all 4 of the goals, so you'll have to read that yourself. Back in February, I participated in a meeting of the President's Task Force principals, in which we agreed to produce this action plan and discuss the goals that should be included. So I'm really thrilled to be here today with all of you to mark the release of the action plan. It's been a lot of hard work. By working together with our partners at the federal, state, local, tribal, and territorial levels, we can continue making progress to reduce child lead exposure and the associated health effects. The action plan provides us with a roadmap to achieve that goal. Secretary Azar and I are proud of HHS's involvement in the development of the action plan. In addition to co-chairing the President's Task Force and its senior steering committee, experts from across our department have been actively involved in producing the action plan and will work to implement the plan within their respective agencies. Some of the subject matter experts are here today, although others, including those from the CDC and the National Institute of Environmental Health Sciences, which is part of our NIH, were not able to be here. But on behalf of Secretary Azar and myself, I'd like to thank all of our scientific and public health experts at HHS and across the federal government for your work on this important issue. It is vital public health work. Our federal partners work to reduce levels of lead contamination in the air we breathe, in the water we drink, the food we eat, and the objects that we use on a daily basis. The action plan identifies ways that HHS can better participate in and support this work. The action plan also contains important provisions to better identify children with high blood lead levels and make connections to appropriate services to avoid or minimize potential long-term health consequences resulting from lead exposure. Supporting these efforts are the actions identified in goals 3 and 4 of the plan: improving communication with the public on lead and supporting research into lead exposure and addressing related health risks. And we at HHS look forward to engaging with our partners to advance these goals. As we work to implement actions included in this plan, we're going to continue to update the public on our progress. I've asked our Office of the Assistant Secretary for Health, which coordinates public health activities across HHS, to monitor the implementation of our activities at HHS in the action plan. And we are going to continue to work closely with EPA, with HUD, and our other task force partners to implement these activities. So thank you again for joining us to mark this occasion. Thank you.
At this time, we're happy to take a few questions from the press on the lead report. If you can just identify yourself and which publication you're with.
Hi, I'm Arielle with EME News, and I'm wondering, EPA's previous two budgets have proposed cuts to lead-related programs, including eliminating the lead risk reduction program. Can you commit to not proposing reductions to lead-related programs in the next budget?
Well, you know, there are other areas in the budget where we've increased funding for lead programs, so we're moving some of the programs around. I point specifically to the WIFIA grant program, which has seen increased funding over the last 2 years and increased funding for next year, and we're using that to target a lot of water infrastructure around the country to reduce lead-contaminated pipes in communities across the whole country. So we have different programs, and we're shifting some money around from one program to another. We also unveiled a couple of new programs this fall on addressing lead pipes in schools and daycare centers as well.
And I would just add to that, just in looking over the last year and a half, you know, our budget for lead prevention activities has gone from $125 million to over $230 million. So this is an area where we will continue to place emphasis on something that we hope to be able to eliminate.
The next question.
Hi, I'm Ellen Declare with the Associated Press.
Hi, Ellen.
The CDC says there are 500,000 children under 5 living in households where they're exposed to levels of lead that require public health actions. Does this plan include any deadlines for dealing with homes that are contaminated with lead at levels that are a concern to young children? Does it have any extra enforcement action recommended, or does it have any new specific mandates that communities and states should meet to reduce the lead levels in those homes?
Well, I just have to say that the action plan across the board for all of the agencies and departments has a number of new steps and milestones that we've all agreed to take, at least from the EPA's perspective. We will have our new lead dust standards out by June of next year, and we're also working on the lead and copper rule to update to reduce lead and copper pipe contamination around the country, and we expect to have our proposal out in the spring. So we're moving forward on a number of regulatory programs to reduce lead exposure in homes, and those different regulatory programs envision different enforcement mechanisms and so forth. But we're moving forward on a number of different fronts, and those are outlined in the report for each of the agencies and departments.
And there are also much more robust efforts underway to identify the affected children, and to not only mitigate problems in the case of that child, but other children who are around them. So utilizing that as sort of a harbinger to tell us that there's more issues related to that exposure.
Yeah. You know, and obviously we will be monitoring as the new regulations are put out and as we continue to work on the implementation of the action plan. We're going to continue to monitor those numbers and to sort of notify progress as we move along from the public health point of view.
NPR. Question for Dr. Carson. Back to NPR. How are you going to make sure that housing authorities are going to comply with making sure that there's not high levels of lead in public housing? I know you were in New York yesterday, where that has become an issue.
Well, it's a combination of federal, state, and local responsibilities, and tightening those responsibilities, making sure that the housing authorities and the cities in which they reside recognize their part, because it all cannot be done at the federal level. We can certainly set out the policies and the rules, but enforcement really needs to be done at the local level. And we're putting in place mechanisms to make sure that that does happen.
So just quick follow-up, there's nothing in this plan that would trigger any kind of penalty or kind of sanction on a housing authority that does not comply?
That fits into another category outside of this agency, but it does fit within the purview of the oversight that HUD has in public housing and in certain multi-family housing units.
Any other questions?
I'm David Brown with the Inside EPA newsletter. I just wanted to ask, it's been announced that the CDC will lower its blood reference level for determining when children's need help from 5 to 3.5. I was wondering if Administrator Wheeler can say at all about how you anticipate that change will affect your existing standards for like lead in soil, or how it will affect future rules going forward.
We are using and working with all of our sister departments and agencies. And as those numbers are revised, we're taking a look at all of our regulatory programs and advising them accordingly. And as I said, we'll be going forward with our new lead and copper proposal in this coming spring, as well as the new lead dust standards for homes by June of next year. So we're taking into account all the changes in numbers as we all work together. And there's been a great collaboration among all the federal agencies and departments in addressing the lead issue across the board.
Hi, David Schultz with Bloomberg Environment. I was looking over some of the action items in the plan, and I noticed that a lot of them were things that were already underway or maybe have been underway at the EPA for several years, such as, as you mentioned, updating the lead and copper rule, also updating regulatory changes to lead-free plumbing. Can you point to a few or any action items in the plan that weren't already something that your agency or the other agencies were working on prior to the release of this plan? In other words, is there anything new in this plan, or is this just a compilation of things you were already doing?
Well, I would say it's a combination of both. We did not want to hold back any new programs until the release of this report. For example, we unveiled this fall new grant programs to reduce lead pipes in schools and in daycare centers, and that's included. And that I would say that is new, but we went ahead and launched it this fall because we were able to launch it. We didn't want to hold up any new programs. The lead and copper rule, while it has been under review and hasn't been updated for over 20 years, I know the Obama administration looked at it for their entire 8 years of their administration. We are getting very close to coming out with a proposal and be out in the spring. So again, some of these, you're right, have been worked on for a while, but we didn't want to hold up any particular announcement of a new program just for the action plan to come out. This action plan is a compendium of everything that the federal government is doing across all the agencies and departments, and we didn't want to lose any time on any of the individual projects.
So just to follow up, so there's nothing new, there's no new.
No, I think there's quite a few new things in there, and there are things that were just launched in the last 30 and 60 days that are written up in here. But announcing specific milestones for the lead and copper rule, things like that is new. While it may have been worked on for quite a while, we're committing to specific timeframes to getting these things done. Thank you all for coming.